They have it all here.
No, I don't know.
Therefore,
Well,
the plans must be adapted to 2 different languages.
Now that I'm-
analog and digital.
sure. No. Analog will always be there because it's like the beginning, you know, studying. So, well, you need to know it, but afterwards it is like you have to keep going. The kids who graduate, say they're in their first year, they will graduate when? In 2030. And that's it, you know? It's the same. Or 2031, you see? Already. I will be getting old, but the kids are moving forward very fast. So, well, later we will see some of your cases. Later, we will see. But, well, I am going to talk here with my friend from 𝗗𝗶𝗀𝗶𝗺𝗶. You do everything in digital.
That is correct. Everything that can be done digitally, yes. Obviously,
When
a
I
big part
saw
of-
on your Instagram that you spoke a lot about how the most important thing is the calibration of the resins, is it?
For 3D printing, just a small part of it all.
Yes, of the whole ecosystem. Do you give courses like that on all the software that exists in that?
Yes. Intro courses to
An
digital tech.
introduction,
That's right.
and what are they like? Are they online or in person?
They're in person? Yes.
Yes.
Next week we have one in Cordoba at 𝗗𝗶𝗀𝗶𝗺𝗃. Later in September in Tucumán, and in October in Chiapas in Mexico.
Are you going to the Congress? No, that's in August. But I was told that you are going to... Why? Because a Cordovan is here. No, it could be a visit because you can visit someone, but the real story is where you are going.
I am heading to Sao Paulo for an aligner conference.
That all the orthodontists attend all the conferences in Sao Paulo.
Sao Paulo is nice,
Is it
right?
because the center of the story is there?
And Brazil has very good
Very
dentistry.
good.
Yes, it is not that it is only there, right? A little
In
while
aesthetics,
ago,
it is fantastic.
we held the summit in Cordoba, which was also very good.
Ah, look.
It is
Look.
one.
And what are you going to see there? Invisible aligners, but why are you going to do that? What are you going to do there? What is it? Well, a congress only for
Congress
aligners.
only for aligners, exactly. The best speakers in Latin America will be there.
I will ask you the same question I just asked the gentleman who left. I was told that there are now aligners without attachments that can move teeth.
I heard it while I was in the Uber. It was very crowded. It is now in Buenos
Yes,
Aires.
very
isn't it?
crowded, my mom. And it is
Very
the same
crowded.
as Cordoba capital,
Yes,
you
yes,
see.
worse,
It is
worse.
crowded. Well, yes, we are crowded.
But I believe you're talking about printed aligners, right? Which, well, they are
Yes.
sold as more efficient, no attachments because you have other configurations. Two different forces. Exactly. There is still not that much evidence that demonstrates that they are better than thermoformed ones, right? You have, I don't know, 𝗗𝗋𝗃𝗰𝗋 doing tremendous with printed aligners, but well, it is 𝗗𝗋𝗃𝗰𝗋, right? The evidence is still there, yes?
I was left shocked because there, I look at Instagram, TikTok, everything because I am looking at things to put the program together, and I do not know who Don Toblo is, if he is from here or somewhere else. What? You know when Colapinto was with Messi? What? He did a zoom, he was getting closer, and in his smile you can see the attachment.
Yes, I think it was Danny, right?
I don't remember
Yeah.
who it was, I don't know who, but I say, wow. And he had the attachment, and the attachment was clearly
Yes, they
visible.
are seen.
It was visible because, you know, they said no, because he has veneers. You know, everyone, he had white teeth, I say.
So,
Not that white, but they're white.
Leo is heading to the World Cup with aligners.
But, well, he is going with the attachments on there. Wow.
Well, I hope he does well.
Hopefully, you know what? I will get an attachment myself if we become champions again. Sure. I promise that if we become champions, I will put an attachment on my canine so everyone can see it. Go for it. It is recorded. Go for it. I'll send the photo. Listen. In Cordoba, besides aligners, what else do you do?
Mostly aligners and some rehabilitation, yes, but no.
Solo alineadores.
Ortho brackets. Well, okay.
Orthodontics, yes, both.
Same question as the guy from Spain. Percentage of
Yes.
aligners versus braces?
I personally would say
Yes.
80% aligners and 20% practices.
Can it be used for all cases now?
Yes.
Even if there is here, yes, one here, the other behind, the other crowding,
Yes.
even if there is crowding, because before it was only for The small issues you see for certain mild movements.
Obviously, there are cases in which brackets will be much more efficient than aligners, and other cases where aligners are more efficient than brackets. Yes?
Yes.
But all cases can be treated with aligners. How are
may
you
take
going to
time.
put it? Sure, exactly. Yes, there are more difficult mechanics. Yes. But you can do any type of case. Impacted canine, whatever.
Yes, I had to. Oh, let's see that one.
B. The little video. Yes, yes.
Let's see. Can you see it? There it is.
There it is. It
It's
is
what you do.
Yes, that little video is a case of aligners that is not finished. I just sent it to demonstrate the level of predictability we have when planning a case with digital orthodontics. Which again, this is aligner software, but I could easily design that case and treat it with braces, right?
Sure, yes.
The difference is that there I have the patient's real roots. It is a tomography that is matched with the patient's STL.
Yes.
And look at the force vectors that are seen in real time. How each aligner is going to apply that force in each step of the treatment. Yes.
And so,
Then
that is where you place, for example, the attachment.
Sure, I am placing it there. You will see later how I position the active surface of the attachment perpendicular to those force vectors. That is something that before there was no way to. Let me ask
I
you
will
a
ask
question.
a very ignorant question, since I am not an orthodontist, to be able to plan this and know where, because you have to know where to put the attachments, right?
Yes.
Because they did not teach you that in college.
And
You
it-
have to take a separate course. Yes. Oh, okay.
Yes, yes, you have to. Look, it is another orthodontic tool. Sure,
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 sure.
sure. No, not because it is.
Because maybe you know how to design, and it is designed, and you have it fixed with the software, but you do not know where to place the attachments or anything like that. That was never taught in university.
No,
Well,
no.
but now in postgraduate studies you have it. Yes, exactly. Aligners are taught.
Yes, you have to find a postgraduate aligner course, right?
Yes, but if you do the orthodontics postgraduate course, do they not teach it?
It depends on the place, I think. Yes.
I thought they taught
It is
it.
that I am not so sure that you say in the orthodontic specialties today they teach many aligners. No? I do not know. Really? No, I do not know. I think one of the first diplomas in aligners was in 𝗗𝗶𝗀𝗶𝗺𝗶𝗺𝗵. It could be. Many people from here and
Many
all
from
over
here.
there, moving to 3D. From Paulina.
Look, I asked you a question. Everyone in the capital will tell me, but I do not care. Why? Many dentists from here. You know that normally everyone comes here. To the capital I do not know, to study the courses and that. But I know many colleagues who, for example, in facial harmonization, 𝗗𝗶𝗀𝗶𝗺𝗏. In aligners, 𝗗𝗗𝗏, for instance. What is the reason?
I do not have the answer. I really do not have the answer.
But could it be because they start earlier? Because there must be something?
I do not know. I suppose there are great professionals in Cordoba, here in the capital, and in any part of the country.
Surely yes, but I remember that no. Later. Let us say it is like others appear and then they stay, but he has told me himself. And I have, for example, very prestigious colleagues who have done facial harmonization and have gone to Cordoba for the postgraduate course. What do we have? I will say materials. Look.
Well-
I'm going with Miguel's materials.
This is a case we treated in the orthodontics specialty of AOC. That is the planning of a guide for the placement of microimplants, yes? To do a disjunction, it is a modified pen distractor or a BAME, yes? Did you see the MARPE used in adults? Yes, yes, yes. Well, this is used in children, yes? And again, simply send the little video to visualize the level of control we have. You perform the surgery on the computer, yes? In fact, precisely in this class I showed a paper, a meta-analysis that demonstrated that in the placement of guided microimplants we have 9 times fewer probabilities of having any type of complication, yes? So, like today, if you have the tool, there is no reason not to do guided surgery.
No, yes, totally. You vote in favor of that. It seems to me that it has to be that way.
We have to have guided and analog. You have to have the training. Yes, yes, yes. No, no, of course.
Sure,
Then
yes,
the microimplant
yes,
goes in
obviously.
the same.
No, well, but that is something important. Once a maxillofacial surgeon came here, I do not remember the last name now, and I was telling him that they had taken me when we were students to see a surgery that was very heavy. At 11 in the morning, and it finished at 12 at night. Those things, you know, terrible. A le fort, as they say in the book, it falls like a complete one. I was watching it, I was horrified. And then he told me that with all this technology, those surgeries of so many hours can be done in 3-4 hours. And thanks to a technology, I shortened the times. And I also think it has to do with the post-operative and all that. I am not a maxillofacial surgeon, but
I am not either. The doc will tell us better, but I suppose that beyond the times, again, the predictability.
well, both the general anesthesia that we see, it is not the same to have a general anesthesia for 3 hours than to have it for 12 hours in the body.
Neither is it the same to manipulate the tissues 2 hours, 3 hours to 12 hours. The biological response of that is going to be terrible.
It is totally different. Yes, I think that technology has changed abysmally. Well, I know that you brought me some cases, right? So now we are going to look at your cases, yes? Look, I will say, it killed me.
This is from the hospital.
for 𝗗𝗶𝘀𝗶𝗺𝗏. That is an X-ray for 𝗗𝗶𝘀𝗶𝗺𝗏 or not? Our genius of radiology. Look,
A little while ago we were with
𝗗𝗶𝘀𝗶𝗃.
him.
Well, tell me, what is that?
This girl came for a dental checkup
Seriously? A dental checkup
with
and
a
this appeared?
panoramic X-ray of the routine that we do within the service.
Yes.
It was diagnosed as a radiological finding.
And
A little bit, the context in which she comes was the grandfather was our colleague.
that,
That is how it is. Just with this girl, it happened to me.
what? For the people who do not know, what is it? A tumor? A cyst?
That for now is a retained piece.
Very well.
Something that has a radiolucent image
Radiolucent image.
with a peripheral reactional cortical. Very well. And after the biopsy, I will tell you. This was in the
Wait,
middle
listen
of the...
to me. Does it grab the nerve or not?
No, just this case, no. This case, what it had was that it had the emergency. It was bifurcated and, well, it made the extraction of the pathology and the piece a bit difficult. How many years old? Yes, I do not remember. 12 or 13 years old the girl had.
Sure, because that is a retained canine, right? That she had.
Yes.
And here you took it out? Yes?
How did it go? We operated under general anesthesia with Dr. Christian Mosca.
Oh, yes, here. I saw it twice, Mosquita.
We both did the surgery.
But how? Where do you enter? It was really stuck there.
Intraorally? We went in.
How?
She was a young girl. We had to do it intraorally. We couldn't leave a scar. The truth is, it didn't present major difficulties and was a smooth operative process.
Generate bone in that place.
The image, that reactive cortical bone, was visible up until last year. Oh, is that so? Yes, I'm telling you, she was 16, at least 15 or 16. She had turned 15.
For instance,
Then, well,
do you
yes.
see in the sector you have? The lower sector, the premolars? And how did you manage that part? Did she have
Did you
teeth?
move it?
Sure, but does she still have them? Did she lose any? No, no.
The pathology was removed. Did you finish the operation? Is that how she looks?
All lovely. It turned out very well. Crazy. Do we have another?
This was an adenomatoid odontogenic tumor.
Ah, it was only a tumor. But well, let's see. With an image like that, I would not.
Can I say it?
Obviously. We always say the same. You have to biopsy and see. Surely.
We performed the surgery, we did the
You saved her life.
resection of the pathology, and then we sent it to be analyzed.
Yes, but you saved her life from a dental visit to an odontogenic tumor.
It was not like the timing of when these things appear is also very important, because this girl had fallen a few days before it was decreed.
The pandemic and everything closed.
Sure, and we had to operate on her within that first month, when no procedures were being done. So, well, It was all very well
A quite
orchestrated. What can
important
we
context.
do? And well, we cannot be putting her in and out twice, admitting her to wards that also have patients who could have COVID, who are circulating, who are not.
Yes,
So,
yes,
well-
everything is very complex. Well, congratulations to you and Dr. Mosca. The truth is, it was a nice surgery. Tell me something important that you want to tell people about aligners and what you are going to see in Sao Paulo. Can I ask you a favor?
Whatever.
All the people who travel, I tell them that they are my correspondent. I would love for you to film something for me and then send it to me. Well, tell me, look, here. Obviously, I'll show it to the east, it's
Sure.
obvious. And that you say, look, this is the latest thing that has come out. Look at this novelty and show us their lev.
Go ahead.
Yes?
For sure. We'll do it. Go ahead.
Open this boy and I'll say it on air. Notice, if not, he will be punished. Remember,
Reminder.
go ahead, listen to me. What is the most important thing I can tell someone about aligners? Someone who wants them.
I believe they should try to go beyond the myth, the barrier that many orthodontists create with this idea that no, aligners do not work. Yes,
A colleague of yours who was saying those things from Cordoba, let's leave it there, but well,
but that is
that's
what I want you to tell
the people what works for you.
people. I think that basing it more on the evidence and not just on what we believe in, because it's very easy to criticize.
But well, here I think that science and papers and all the technology and science verify that it is so. Yes, obviously, and the clinic too, and the clinic which is sovereign, as they said. Exactly, the clinic is sovereign.
Thanks.
Well, first of all, I want to thank you, Seba Migueles. Thank you for coming. I know you do not go anywhere, that you do not like those things, that you did me this great favor. So nothing. 4 million thanks.
To you, Nancy, and let
all
me share
the
the files.
successes, yes, all that.
August 21st, workshops at Kennedy University at the San Isidro campus, free.
You want, I knew Aloncito was coming.
And October 15th and 16th, College of Dentists workshops, District 2, also free.
Well,
all
it
the
is
talks.
already sent. If they
Thank you.
want to go see you, tell them your office. We'll plug it. Go ahead.
Office in San Martin, Quilmes. Municipality of Quilmes, San Martin, 219.
Okay, well, you Sebastian, Instagram, everything. Of Sebastian, sorry,
Are you baptizing me already? No, nothing
Luca
happened.
Gali. Yes, tell me your Instagram.
My Instagram is Luca Gali, STL.
I will tell you one thing. Follow Luca, the people who like digital, because you give a lot of tips. And it's very good, very good. I was watching it today, that to digital.
And it tells you a lot of things that maybe one says, "Oi, look, I had never realized."
Well, thank you.
I
glad
congratulate you. Keep
Thank
it
you.
up. You have a divine Instagram. And well, I have my new correspondent. So, well, nothing. I want to thank the entire Diente por Diente TV community. Please follow us. We want more. We want to go very far. I know we are already going very far because we are going through all the provinces, and I think we are going to leave the country just like that, just like that. So nothing. Thank you very much. I'll wait for you next Tuesday on Diente por Diente TV at 5:30 that we have a virtual classroom. 6 o'clock I start, so you have to put up with me. So thank you very much for everything. Kisses to everyone. Greetings to the entire Diente por Diente TV community. And I will not hit anymore. I will say bye. Bye bye.